Sukhjit, and in today's webinar, we're going to have a conversation that I feel like is very important to have, and that is the mental health in the Punjabi community. So what exactly is mental health? Mental health impacts our psychological, social, and emotional well-being. Mental health also impacts how we think, feel, and act. It also influences how we handle stress, how we relate to others, and how we also make our choices. Lastly, many people may not know this, but mental health should be prioritized at all ages because mental health issues and disorders do not discriminate. So as you've seen in the previous slide, we've gone over what exactly is mental health, and now I was going to give you guys some fast facts on mental health that can be found on the Canadian Mental Health Association website. The first one is that 1 in 5 Canadians will personally experience mental health problems or illness in their life. Mental health affects people of all ages, income levels, education levels, and of all cultures. Mental health does not discriminate. It can be caused by a complex relationship between genetic, biological, personality, and environmental factors. Approximately 8% of Canadian adults will experience major depression sometime in their life. Mental health is also evident in Canadian youth as well, with Canadian youth having the 3rd highest suicide rate in the world. And lastly, by age 40, about 50% of the population will have or have had a mental health or mental illness. So what are some common mental health issues? The top 2 common mental health issues that are seen in Canadians are mood and anxiety disorders. So it was estimated in 2013 that 3 million Canadians aged 18 or older reported that they had a mood or anxiety disorder. In addition, most people with mood or anxiety disorders do seek out psychological support and are trying to cope with their illness, where 93% of them receive prescribed prescriptions, while only 20% have received psychological counseling. So what exactly are mood disorders? Mood disorders are a mental health class used by professionals to describe all types of depression and other bipolar disorders. There are 2 types of mood disorders. And the first is major depression, which involves symptoms of having less usual interest in activities that one usually would, feelings of sadness or hopelessness, trouble sleeping, and trouble concentrating, with along with many other symptoms. While the other is bipolar disorder, which involves symptoms of depression and also symptoms of elevated mood. For example, someone with bipolar disorder would demonstrate depressive symptoms such as trouble concentrating, trouble sleeping, feelings of hopelessness, but their mood would eventually fluctuate to instances of mania where they would be elevated, excited, and it goes back and forth. So what are anxiety disorders? Anxiety disorders are a mental health term used for anxiety or anxiousness that may develop for somebody for brief periods without an apparent cause. If instances of uncomfortability may eventually start to interfere in their life and can happen up to different months in a time. The common type of anxiety disorders, the first one is generalized anxiety disorder, which involves excessive anxiety and worrying about situations where the person feels like they're out of control. This can last up to 6 months and eventually starts to interfere with a lot of their daily activities. Further symptoms include trouble sleeping. There can also be muscle tension and the need to control the situation, as mentioned earlier. Social anxiety, on the other hand, involves anxiety or fear that is induced about being humiliated or scrutinized in social settings. This lasts to about 6 months and are associated with social interactions, being observed, or even performing in front of others. Further symptoms may include sweating, dry mouth, avoiding eye contact or social gatherings altogether, and several other symptoms that come along with social anxiety disorder. So how does mental health impact the Punjabi community? In 2001, South Asians made up 23% of the visible minority in British Columbia. Furthermore, a study conducted by Gill in 2010 found that when Punjabi individuals seek out mental health support and information from their doctors, their symptoms are often labeled as somaticized, meaning that their symptoms are physical rather than psychological. This leads to a lack of referrals and a lack of care. Other barriers that Punjabi people face when seeking mental health support in the community or from healthcare providers is the lack of accessibility, meaning that there's not enough healthcare support in the Punjabi community towards mental health. Lack of cultural competencies, which means that not many therapists are adequate in understanding the traditions and cultural values of Punjabi culture, and they also experience discrimination in the terms of racism. Lastly, a study conducted by Buie in 2004 found that Punjabi women are more likely to experience or demonstrate depression than Punjabi men. Her underlying causes for this were labeled as due to a lack of education, a lack of support in the community when they come into a new environment, and also had to do due to the gender discrimination that is experienced within Punjabi culture. Mental health stigma within our community is very strong, and it's also one of the reasons why many individuals do not seek out mental health support. In this study conducted by Gail in 2010, she found that since Punjabi culture emphasizes honor, many people may not seek out mental health support due to the fact that they may be shamed for this. In addition, other feelings of judgment, criticism, and social repercussions were also noted. Furthermore, Jiangi in 2011 found that the fear of being labeled crazy, which is a negative connotation in our community, was also one of the driving factors why many people did not seek out help. Chahal in 2019 noted that due to the Punjabi culture emphasizing resilience and strength, many people may not seek out mental health support because it defines as being labeled weak, and that is not what we represent as a community. And lastly, she also noted in her work that many people do not know that the relationship between mental health disorders is a very complex one, and many felt that the reason that a mental illness was onset was due to social or environmental factors, not acknowledging the biological or genetic component of these mental health issues. So what can we do as a community? The first thing we can do is always create awareness. There are several different ways to create awareness, and I've listed some up here. So the first thing we can do is make sure that mental health is on the agenda. So when it comes to election campaigns or to any town hall meetings, make sure that mental health is on the agenda. How is the community and how is the city involved in making sure that there's more mental health support for the Punjabi community? Another thing we can do is start creating conversation within our friends and families. This makes a difference because not only are we bringing knowledge into their household by reading up on it and learning about it ourselves, but also bringing knowledge to our parents and our grandparents, and breaking that stigmatization that is due to intergenerational values. Another thing that we can do is volunteer. So reach out into your community, see if there are any NGOs that are dedicated to mental health or any other organizations that advocate for mental health support, and reach out and see what changes you can make. So what resources are already available to the Punjabi community? The first one that I noticed was from Canadian Mental Health Association, BC, which has several programs that you can reach out to that are also available in Punjabi. The programs are the Bounce Back for adults and youth, Confident Parents, Thriving Kids, and Living Life to the Full. Other resources that are available are 811, which is an advice phone line available in BC, which provides you with healthcare information and healthcare provider information as well. And this helpline translates to Punjabi as well. Another resource that I've listed is Psychology Today. Psychology Today is a website where you are able to search through psychologists, mental health counselors, and therapists. You're able to filter them out through your language and surrounding areas. So with this, you're able to find Punjabi-speaking therapists in Burnaby, Langley, Surrey, or in other surrounding areas. And the last one I've listed is the South Asian Mental Health Alliance. The South Asian Mental Health Alliance is a group that is located in Surrey, and it's dedicated to providing mental health resources and mental health information to the South Asian community. So this brings us to the end of the webinar. I hope you guys were able to learn something new and to see how you can also support the Punjabi community when it comes to mental health information or resources. But the conversation does not stop here. So keep continuing to create awareness and keep reaching out to the community and see how we can be a better support system for one another. Thank you guys.